What excites me the most about the potential of focused ultrasound is its ability to fundamentally transform how we're going to treat our mental health conditions.
The biggest thing that I noticed was in my day-to-day mood, I wasn't having those lows and it was easier to get stuff done. My ability to be present with my family and really enjoy those moments, it was pretty amazing.
Welcome to Curing with Sound, a podcast presented by the Focus Ultrasound Foundation. I'm your host, Allison Preston Smith. Dr. Noah Phillip is a professor of psychiatry and human behavior at the Alpert Medical School of Brown University. He is the leading expert on focus ultrasound neuromodulation for psychiatric conditions, including depression, anxiety, and post-traumatic stress disorder, and is the lead for mental health research at the Veterans Assistance Center for Neurorestoration and Neurotechnology in Providence, Rhode Island. We're also talking with Nick Marinelli, a military veteran who participated in Dr. Phillip's groundbreaking clinical trial for anxiety and depression in veterans. Welcome to the podcast, Dr. Phillip and Nick.
Oh, absolutely delighted to be here.
Glad to be here.
Noah, let's start with you. Can you briefly explain the focused ultrasound neuromodulation and how it's different from the psychiatric treatments that are the current standard of care?
So I'd be delighted to. So focused ultrasound neuromodulation is an experimental, non-invasive technique that uses precisely targeted sound waves to stimulate, or more precisely, modulate brain activity. It can influence very specific brain circuits without the need for surgery or an implant, and it can do this at incredibly high precision at millimeter scale. And I want to be very clear, we're talking about neuromodulation. And in this case, the ultrasound that we're using is a very low intensity. So that's not of sufficient energy to do damage. And we're using that to modulate neural activity. The current standard of care neuromodulation right now in psychiatry is transcranial magnetic stimulation. That uses rapidly fluctuating magnetic fields to induce electrical activity within the brain, and particularly in the prefrontal cortex. It can indirectly modulate many different parts of the brain, but ultimately it relies upon that indirect nature or the energy flowing through the brain in order for it to work. So to really dial in on the exact differences is, focused ultrasound neuromodulation is highly precise at millimeter scale and can get deep into the brain, as opposed to currently available technologies that deliver non-focal stimulation that ultimately rely on an indirect mechanism of action.
And can you tell us more about the current neuromodulation clinical trial that you're leading?
So our current trial is a study of low-intensity focused ultrasound for depression and anxiety. And here we are testing the use of low-intensity focused ultrasound to modulate the amygdala. The amygdala is the brain area that's primarily involved in fight or flight and actually many other processes. And it's overactive in depression. It's actually overactive in many different kinds of other psychiatric conditions. So also in post-traumatic stress and schizophrenia. It's implicated in substance use disorders.
And Nick, would you mind sharing your experience with depression and how your time in the military influenced or maybe impacted those challenges?
Sure thing. So I enlisted in the Army National Guard in 2009 and deployed to Iraq in 2010 as a Black Hawk mechanic and a crew chief on medevac flights. So I was over there for 12 months, came back from my tour, and then started in school. I finished up my 6-year contract and decided I wanted to have a family, so I ETS'd and didn't re-enlist. For the most part, I was experiencing depression and anxiety, but it wasn't until about 10 years after the fact when I finally slowed down and settled down and started working a a regular job.
And when did you hear about Dr. Phillips' clinical trial?
So I started going to the VA Providence about 2 years ago. And I learned about a different study that Dr. Phillip was doing through my provider. And then after I had gone back to another clinic of his, he reached out to me at the beginning of the year, told me about this study, and it was actually at a really good time. I was having some difficulty, in my day-to-day mood and, at work.
Dr. Phillip, can you also walk us through from your end, what's going on? What are you focused on? What are you paying attention to and trying to see in the before and after treatment?
So people will come to the MRI suite. We'll have them sit on a chair, and what we'll do is we'll put some ultrasound gel on the side of their head, and then we'll attach our transducer, which looks a little bit like a hockey puck, and they go into the bore or the center of the scanner. And then we'll deliver the sonication itself. There's 2 10-minute administrations inside the scanner bore, and we're talking to people and checking with them the whole time. And so to your question, which is what are you looking at when the treatment is being conducted, there are 3 primary things that we're focused on. I want to say first, as a reminder, low-intensity focused ultrasound neuromodulation is experimental. We are doing this current study with with oversight from the Food and Drug Administration and from the various funding agencies that support the work. And so our first concern, my first duty, is to safety. And so we're always checking to make sure that things are safe, double checking, triple checking. We'll do that through neurologic exams, and we'll do that through brain scans as well. So while people are in this scanner, we get essentially what's like a stat neurologic read from a radiologist. And that's really to give us an extra level of comfort that things are all going well. We are also looking for brain changes, and these are, in layman's terms, really what we're looking at is how different parts of the brain can speak to each other. We're looking at a neurovascular tone and biological activity inside the brain after the sonication. And of course, we're looking at people's symptoms, both how they say they're feeling, we ask them about certain things, and we also keep a very open mind to the things that people will tell us that we haven't prompted them to tell us.
Nick, now that you've had all of these treatments, how are you feeling afterwards? Have you noticed a difference?
Yeah, so I would say after the first treatment, the biggest thing that I noticed was in my day-to-day mood. Prior to it, there were a lot of ups and downs during the day that kind of made it difficult to get through. And after that first treatment, it was definitely noticeable that I wasn't having those lows, and it was easier to get stuff done. And then after the second treatment, it wasn't until I want to say the 1 week follow-up that it really stuck out to me was my ability to be present with my family and really enjoy those moments. In particular, my daughter graduating from kindergarten. It was absolutely, it was amazing to see her up there and see her happy. It was pretty amazing.
Has your wife or your family, have they noticed a change in just your day to day or your moods or anything like that?
Oh, my wife definitely. It's certainly, she's certainly happy about it. So, especially when it comes to the kids.
Yeah, that's great. That's so wonderful to hear. Noah, what else have you heard from other participants?
So we've treated 10 participants in the first phase, and we are just about midway through our second phase. So I'm just going to talk about the people that we have completed officially, because that part of the clinical trial is done. So clarity, lightness, and calm are really the main themes of spontaneous reports that we have heard in terms of benefit. There certainly have been side effects, and I don't want to minimize those. And so we do commonly hear about headache, fatigue, or difficulties with concentrating. And we had one person whose symptoms got worse about 24 hours after they received the ultrasound. This is the sort of thing that we expect when we are doing psychiatric research, and this is the sort of thing that is incredibly important to be aware of, and why we do research in a very careful way. We ask lots of questions, we do lots of brain scans, and this is something when we're doing informed consent about the study in the first place, I always tell people about. Because again, my job here is to help find ways to get people better. But we're doing things that are experimental, and we're very much venturing into the unknown, and I want to make sure that we do it in a way that's thoughtful and that we're prepared for what might happen.
And so what's next for you and your team? What other clinical trials are you hoping to start?
So we have 2 upcoming clinical trials. One will be starting recruitment soon. The first study is looking at some other targets in the brain that are hard to get at with traditional brain stimulation, and seeing if we can help change how people are able to make decisions. That's one study. And that's done by my wonderful colleague, Amanda Arlpagasan, who's a psychologist here at VA in Providence and in my center. The other study that we're going to be doing is we'll be launching a sort of 4-year randomized controlled trial looking at different doses, so different numbers of applications of ultrasound to our targeted area. And so our next question is how to figure out an optimal dosing strategy so we can think about clinical implementation. And that's a study that will be funded by the U.S. Department of Veterans Affairs, which we're very grateful for.
So, Nick, what would you say to others who are considering participating in a clinical trial like you have?
It's something I would encourage anybody dealing with depression, anxiety, or PTSD. And the reason being is that with a lot of treatment, both medication and therapy, is that it takes time, particularly therapy. It's something that I struggled with for a long time is, why am I doing this if it's never going to get better? And I think that's the biggest benefit of these non-invasive treatments and the focused ultrasound in particular is seeing those immediate effects and having that hope.
And do you have a message for other veterans or just listeners in general about the importance of, fighting for your mental health and finding solutions, and even just, having more candid conversations about these topics?
Yeah, we just need to normalize the conversation. We can combat the stigma by having the conversation with anybody you see, with friends, coworkers. I see it as any other sort of disease or injury. If I broke my arm, I'm not going to ignore it and just hope it goes away. And if somebody sees me in a cast, they're going to say, hey, what happened? And I think that we need to have conversations about mental health in that way.
How would you describe the impact focused ultrasound has had on your health?
I think the biggest effect it will have is in how I'm able to be a parent and a father. I think it's immeasurable in the effect it will have in my relationship with my children. My children are the most important thing to me, and I want them to know that.
Noah, in 2024, you participated in a congressional briefing to advocate for expanded access to focused ultrasound treatments. So why was that important for you to do?
So I very strongly believe that researchers have a responsibility not only to advance science, but also to ensure innovations reach people who need them the most. Focused ultrasound has remarkable potential as a future non-invasive and targeted treatment for depression, for PTSD, for many of our psychiatric illnesses, and particularly for individuals who haven't responded to traditional therapies. Scientific progress alone isn't enough. Without awareness, without funding, without policy support, breakthroughs stay in the lab, and that's just not where they're needed. Engaging in advocacy bridges the gap between research and real-world impact. We can inform policymakers of the clinical promise. We can clarify misconceptions and emphasize the need for access, and particularly for veterans, underserved communities, those with treatment-resistant conditions. It's really about translating science into the public good, and that really requires a voice beyond the academic journal.
And Noah, what excites you about the future and the potential of focused ultrasound?
Yeah, so what excites me the most about the potential of focused ultrasound is its ability to fundamentally transform how we're going to treat our mental health conditions. As a psychiatrist and researcher, I've seen firsthand how people just struggle for years, trying multiple medications, multiple therapies with limited relief. And focused ultrasound offers something fundamentally different than anything else that exists right now. It's the ability to specifically modulate brain circuits at high precision without drugs, without invasive procedures. It's precise, it's adaptable, it's non-invasive. All these are qualities that can significantly reduce side effects and improve outcomes. And the technology is incredibly versatile. And we're learning a lot about how best to use focused ultrasound. And this is going to allow us to personalize the treatment, which all brings us closer to treatments that are faster acting, safer, more effective, and meeting the needs of our patients.
And how can our listeners keep up with you?
I am findable on social media. I'm on X, Blue Sky, LinkedIn. And I would say if you're a veteran in the Providence area or greater Providence area, which really is most of New England, please reach out and see if you can participate in one of our studies.
Great. Well, thank you both so much for being on the podcast. Thank you for sharing more about your clinical trials and about your research, Dr. Phillip. And Nick, thank you so much for sharing your firsthand story, participating in a clinical trial, and your experience receiving FUS treatment.
Thank you for having me.
It's a pleasure. Delighted to be here.
This episode of Curing with Sound has been presented by the Focus Ultrasound Foundation. If you'd like to learn more about Focus Ultrasound or the Foundation, visit our website at fusfoundation.org. You can also sign up for our newsletter and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information about Focus Ultrasound. You can also rate and review the show.